parasite resistance and anthelmintic resistance or drug resistance are actually a little bit of some confusing terms there, because sometimes it's not clear whether we mean the host resistance to the parasites, to infections, so in other words, immunity, or whether we mean the capability of the parasites to withstand the treatment that we're trying to kill them with. Normally, when we use the word resistance as parasitologists and veterinarians, we talk about the drug resistance within the parasites. So just to get that clear. Yeah, so what is that? I mean, by definition, the drug, the dewormer, the anthelmintic, once worked, but doesn't anymore. So there has to be previous data on this drug. It actually has to have been approved for this particular parasite and the stage of the parasite with a labeled efficacy level. And then we can document through methods that we have now provided guidelines for, we can document that that is no longer the case. And so that's what defines resistance. The drug doesn't work anymore, but it used to. So there's a lot of different dewormers, and we can all think about products that we used on our horses last, but there's actually very few different classes, so kinds of dewormers. So a lot of the dewormers actually belong to the same class, and when they belong to the same class, they have the same mode of action. So there's actually only 4 different classes of dewormers available for horses, and some of them only have one drug, one dewormer in that class. So the most important class in many ways is still what we call the macrocyclic lactones. So that's the class where we have ivermectin, the most used anthelmintic, the most used dewormer ever in history, and moxidectin, its cousin. Those 2 belong in that class. Then we have the pyrimidines. That is the class where we have the pyrantel dewormers, and we can think of a couple of products there. There's really only this one active ingredient in that class, and it's a class that's been around since the 1970s. The oldest class that we have is what we refer to as the benzimidazoles. In the US, we have 2 different current dewormers on the market in that class, fenbendazole and oxybendazole. In other countries, there might be other members of this class on the market. That has been around since the 1960s, and that's also the class to which we see the most drug resistance, simply because it's been around for the longest. The 4th class is a class of a tapeworm drug that sort of belongs in its own class. We call that praziquantel, and you can find that in combination with some of the other dewormers that I mentioned before. So that's a class for one particular target, the tapeworms, and it only has efficacy against that. Dewormers are used somewhat differently between countries. I mean, interestingly, it is the same dewormers that are available everywhere. And we also tend to have pretty much the same types of parasites in the horses, same species that we find in the different continents and countries. But the use of these products is regulated very differently. So here in the United States, you can go to Tractor Supply or Walmart or wherever, and you can get them just off the shelf. In other countries, they're prescription only, which means that only the veterinarians can actually prescribe the product. And they usually have to make a diagnosis or somehow justify this prescription, which, you know, is a tight restriction and means that animals are typically dewormed less in those countries. There's a bunch of different examples of how this is administered in the different countries. In the United Kingdom, for example, it is prescription only, but it's not just the veterinarians that can prescribe. There's also special qualified persons who can do that. They have to take an education to become a prescriber. But there's different people beyond the veterinarians who can actually prescribe these drugs, which is an interesting scenario. So every country is slightly different.